You hear all these stories. I've never had a near-death experience, but I've known a couple of people that did that were pretty convincing, where they feel like they rise out of their body and they're looking down. That just gives me some hope that there is more than just, we close our eyes and that's it, like a
Mm.
dead flower. I think there are souls, but whether there's a God, I don't think there's somebody up there with a white beard floating around in robes. I don't know what there is, but I believe there's something after this life.
I am going to introduce you properly now. This is a podcast called In Conversation with Frank Schaeffer, and I am Frank Schaeffer. And my guest today is Dr. Carolyn Larkin Taylor, MD. Dr. Taylor is a seasoned neurologist who has dedicated over 3 decades to the practice of medicine. She is a graduate of the University of Notre Dame. And can you pronounce that for me? Hanan
Hahnemann.
Yeah, okay. All right. Hahnemann Medical College. She completed a neurology residency at the University of Pennsylvania, where she was awarded the Humanness in Medicine Award and recognized as one of the Philadelphia's top docs for women. She is the author, and that's why we're here today, of Whispers of the Mind, a neurologist's memoir, which I'm holding up here and we're going to discuss at great length. And she's in conversation with me. That's Frank Schaeffer. Please subscribe right now on YouTube to this live stream, but also later when you watch it, and to In Conversation with Frank Schaeffer at Spotify and Apple Podcasts, and to my Substack commentary page, it has to be said, at frankschaeffer.substack.com. You can also follow my new project at thegospelofzip.com. Okay, that was the whole thing. Okay, so this is a weird way to start an interview on a book, but I just want to tell you that for many, many reasons, I feel so connected to you having read this book. And I'm going to start with a question that was not answered in the book. What hospital was your son's surgery in when he wasn't keeping down his food and projectile vomiting there when he was just born 30 years ago or whatever it is now?
Holy Redeemer Hospital.
Okay, because I spent 6 months at CHOP, Children's Hospital in
Okay.
Philadelphia,
Okay.
back in the 1970s, doing a documentary series with Dr. Sierra Koop, who then went on to become Surgeon General. And so I lived in the Hilton across from CHOP, and I was trying to picture whether you were there. And then in that case, since I knew all the surgeons in the hospital because I made this movie there and all at that period, sort of 70s and 80s, whether I would know the surgeon or not. So that bit of minutia and bookkeeping is done. Let me tell the readers about my listeners something about the book. The first thing I want to do is just show you the book. Do you see how dog-eared that is?
Yes.
And this is not fake. Every single page that's dog-eared is underlined. Every single page has notes. I read, 3, 4 books a week because of my podcast. And I can honestly say nothing I've read in the last 5 years has drawn me in like this book. I really loved it. And because fortunately I had the whole morning to read it, sitting out on a porch in the sunshine with my dog, by the way. So it was, yeah. And the first thing I want to tell people is that the connections here with what I've been working on for the last 7 years, which is a new project, which we're not here to talk about, but actually features my dog Zip, Z-I-P, and the posters behind me, The Gospel of Zip. And the subtitle could be pulled out of your book. And after that, we won't mention my new project. It's not out yet. I'm selling your book, not mine. But the subtitle is A Canine Human Love Story Exploring Why Most Dogs and a Few Humans Live Joyful Lives. So basically, my dog is sort of my guru. So
Yes.
when I got to the part in the book where your Kenyan patient, I think she was from Kenya, was reticent about patting the dog, and then he comes back and puts his head next to her, and you're saying, well, gee, maybe I should do the tests again. What has my dog picked up on that I missed? All I can think of is the way I had when I was 2, I had polio, and so my left leg is completely atrophied, and it gets freezing in the winter. And Zip sleeps in my bed, untrained, unasked. I have no idea why he started doing this. When my leg's cold, he goes down under the covers and lies over it till it's warm. And this is a dog who finds every sunny spot in the house and always sits next to our wood-burning stove. So, you had me complete. As soon as there was a dog involved, I was all in.
Yes, yes. She was, I have a picture of her right here because you
Yeah,
can see.
please. In the book itself, there's another lovely picture of you here together
Yes.
on your page where you thank your dog. And then there's a chapter on her earlier. So this is not where to start a book on medical practice, but I think this will be something we'll both enjoy. Tell us about your dog and how you worked her into your clinical practice and the reaction of patients. And I think, I shed a manly tear, if you want to put it this way, literally, in reading the story about this guy who became a paraplegic, completely paralyzed because of a spinal cord injury. And he's sitting in a wheelchair, and your dog goes up and puts his paw or his head, her paw or head on this guy's lap, and it sort of turned it around, and it gave me a vision of this gentleman at some point having a dog, and maybe that changing his life a little bit. So talk about your dog at length, as long as you want to, because it's a fascinating subject of how that worked in with your medical practice. And then I'll ask normal questions.
Okay. Well, it was towards the end of my career. We've always had dogs. We love dogs. And um, I had lost a golden retriever a few years beforehand. And
Yeah,
so at Christmas time, I got a dog. It was in the middle of a blizzard. We went together and we had seen pictures of her online, dancing through the snow. And so Christmas snow, we named her Prancer. And I had another older dog at home, and I started leaving her at home with the older dog. And I would come home, and my staircase was chewed up one day, and she just had this terrible separation anxiety. So I was practicing in a private practice then. And I thought, well, I'll just bring her into work. I can put her in my office, close the door, leave her with lots of toys. I'll go in and see her between every patient. She's
yeah,
got a big window to look out. And I thought that would be the end of it. But she howled every time I would go into an exam room because she was left alone.
yeah.
And before long, the patients heard that there was, oh, of course, they could hear that there was a puppy there, and not just any puppy, but a golden retriever puppy.
Mhm.
Everybody wanted to meet her. And at first, I was afraid she was going to slow me down because I have to take care of people and I have a schedule. But she just charmed everybody. And from the very beginning, as soon as I would engage the patient, and start to interview them, she would settle down. She'd lay down and just be perfectly quiet as if she knew that we both had a job to do.
Yeah,
And before long, my patients that were coming back would call and say, we only are coming if Prancer's there. If she's
yeah,
not, we schedule when she's there. Because
yeah,
everybody loved her. It was a rare, rare person that said, no, I'm not comfortable with the dog in the
yeah.
room. And so as time went on, I realized, she was a big part of my practice, and she
Mm.
wasn't interfering here,
Yeah.
that I was going to get her officially sanctioned by the Pet Partners Program
Yeah,
because
and you
that's
have a
where
great story about her final exam on that and how you had to talk to her and say, now this time don't blow it. This is our second chance. And after this, we're done. It was
yeah.
like,
And she listened to me. It was as if I could understand what she was saying to me,
yeah.
and she could understand what I was saying to her. We had such a connection.
Mm,
I, I looked her right in the eye and I said, "There's one thing she just couldn't do,
yeah,
and that was go past another dog
of course
without
not.
saying hello. If I
She's
asked
a
her
social animal. She wants to say hi. I mean, good luck with
exactly,
that. How do you train a
exactly.
dog not to be friendly? Good, how do you do that?
Good luck. Exactly.
Yeah,
So I looked her in the eye. I said, you just have to do this once, just this
yeah,
once, Prancer. And she did. And
yeah. It was great.
we went out with our certificate. And so I could take her to an
Yeah,
infusion center. I could take her into the hospital. She could go with me as part of my practice.
yeah,
And when I left private practice in Bellingham, where I live, and I joined a large university center in Seattle, where I worked for another 7 years,
yeah.
they were thrilled to have her come with me.
That's lovely.
And
Yeah,
they
that
were
would have been a deal breaker if they had not been pro dog.
absolutely. And there was no other therapy dogs in the university system. And then when I stopped doing that full time, I worked for this university system, going to Alaska and outreach clinics where they didn't have
Yeah.
neurologic care. And they said, please, please, you can take Prancer with you. We'll pay for her on the
I
airplane. We'll
love
do
it. I love it. Well, they were smart people because you know what? I mean, that's just absolutely priceless. Somewhere in the book you mentioned the fact that you believe in angels, and of course you talk about angels in human form coming, but when I look at the impact that Zip has had in our life, and before him, our little dog Portly that we picked up in South Africa when I was directing a few movies over there, um, it's not an exaggeration to say that they helped change my life. I mean, you talk your dog, therapy dog, but genuinely speaking, changed the way I relate to other people.
Yes.
And to myself, and even within our marriage, the effect these dogs have had on my relationship with my wife um, are huge, and they're all things that fit with your book. But anyway, let me go to another thing, a theme that runs through this book, and I'm going to ask you if I asked Ernie here when this would be, and he says the book came out in August, and we're going to put it in our book club called "It Has to Be Read," and I'm going to look at the month here in a minute. But this book, Whispers of the Mind, and by the way, is the cover that's in the stores the same cover?
Yes, it is.
Okay, great. So we're not showing something that's going to mislead people. There's many themes that run through this book, and your compassion and your kindness as a physician is one of them. And it goes without saying that I was very touched by that. But one of the things that surprised me in a good way was there are 4 instances in the book, if I counted right, ending with your own brother's misdiagnosis and mistreatment by some very careless neurologists and a heart specialist that was not doing their job. You have a theme running through it, basically saying, hey, you cannot trust all medical decisions. And you're not sort of on the conspiracist end of anti-science thing. It has nothing to do with that kind of thing we're living in the moment. But basically, in your stories, you tell the truth about the fact that you have to. One of the points you make at the end of the book is saying, you sort of sum up that little section, if I can just get there without too much fumbling around, by saying, you have a little list here saying, the top signs of medical gaslighting, and this is particularly to women, but this is addressed to everybody. They dismissed your symptoms, they invalidated your experience, they blamed or shamed you, they refused further testing or treatment, they ignored your medical history, they lacked empathy or compassion, they intimidated you. But beyond that, you tell of individual stories where there's just, bad practice. And I thought that gave the whole book a kind of a credibility that you don't usually see in professional memoirs, especially if someone's still in practice to some extent, because all of our clubs stick together. You don't get much truth from people, from dentists or doctors or firemen or cops or anybody else. We all sort of herd together. Tell me about that. How did you come to that decision? And is it just part of the writing process? And later, did you think, okay, am I leaving this stuff in? Was there more that you cut out? Just let's talk about that little thread that runs through it for a while, because if you hook all those together, it's like, hey, not all doctors are created equal.
Yes, and I think most doctors are in medicine because they truly want that human connection and they want to help people.
Yeah.
Along the way, we're all affected culturally.
Sure.
Women are brought up to express their feelings more than men, so men tend to be stoic. So a woman is more likely to come to a health professional with their problems.
Yeah.
And so, the uterus comes from the Greek word meaning hysterical.
Sure.
I think from, time.
Victorian doctors used to talk about womb fury.
Yes, yes. And so,
the whole bit.
So I think there's a little bit of that going on, but also, women can get gaslighted by a woman vision too.
Yeah, which you say in your book, you say that.
Exactly. And one of the things is, maybe they don't know what's wrong and they're frustrated because they've tested and okay, I'm so frustrated. This must just be stress.
Yeah.
I'm not going to do this test again. And I think we have to go back and this goes along with being tired, being burnout. This particular physician was retiring in 2 days and trying to pack for Europe.
Sure.
And so the last thing she wanted was someone to come in with a problem that she was going to have to deal with and follow up on.
Yeah.
And so some of that is unconscious, but I think overall doctors still want to help, but they're tired.
Yeah.
The situation with my brother,
which I thought was, by the way, the most poignant case in terms of I won't call it malpractice because that sounds litigious, but wrong-headed practice. You went into some detail there, and it was really sad. The whole family in the room, and you knew he needed a full neurological workup and an MRI and the whole pit, and they weren't going to do it. They were busy. Oh, we'll talk to him on Monday, and then he dies. I mean, it's a tough one.
It's a Friday. And
Yeah.
so, having gone through all the training and practice, bad things happen on Fridays. They just
Yeah.
always, the emergency is going to walk in at 4 o'clock on a Friday afternoon. And, this is at the Jersey Shore. And first of all, I don't think there was any malpractice with my brother. I think he went in with really severe vascular disease that he
Sure.
didn't know about. He should have been in a more um, academic center, but they brought him to the nearest hospital and they did their best.
Yeah.
Um, but the problem was when it was clear to me, just as a neurologist, just walking in and seeing him and doing a cursory exam, he
Yeah.
had a massive stroke. And I told the cardiologist that. He said, "Oh, no, no, he's just slow to wake up.
Yeah.
We're going to let him see how he does and we'll look at him again on Monday." Well, I think the cardiologist probably knew, but it doesn't
Sure.
look, as I pointed out from an experience I had once as a
Yeah.
resident, it looks bad for his statistics to do
Sure. Yeah.
catheterization and then have someone come out of it with a massive stroke.
Yeah, because it could be associated with what he did or not, but either way, it opens that question.
It does. It does. And so then when I insist on a neurology consultant, they
Yeah.
come by and they said, "Well, it's not clear. I think I'm going to wait until Monday, see how he does over the weekend." Well, that's
Yeah.
that's not good enough.
No.
Got somebody with a devastating injury that
Yeah.
needs care now. By
Yeah.
Monday, he would have surely been dead.
Yeah.
And the family needed answers. They didn't need to sit there wringing their hands for
Yeah.
a whole weekend watching him lying there unresponsive. And the fact that you have a neurologist family member there telling them you need to
Yeah.
call a consultant, you
Yeah.
need to do an MRI, I think that just angered them. And
Yeah.
this particular
Tipped them off.
consultant just said, "Well, I'm leaving and I'll be back Monday."
Yeah.
And that's just unheard of. It's unconscionable.
Yeah.
And so things like that happen. And of course, it was my brother it happened to.
Yeah.
I was particularly upset.
Yeah. And you were saying one thing you felt robbed of was the ability to grieve because you're at the funeral and you're unable to cry because you're still sitting there as a doctor mulling over his diagnosis and how he was treated, not there so much only as his sister. So it took the personal. I thought that was very touching.
It took that ability away from me because I had to become his doctor there. I had to explain to the family what had
Sure.
happened.
Yeah, because nobody from the hospital's doing their job. You're not wearing your white coat that day.
Exactly,
The
exactly.
long white coat that you earned after your short white coat,
Yes,
the residency. Hey, I have a question for you that relates to I guess, the major theme that runs through the book, aside from these incidences of bad practice and warning to patients that I think is really good to absorb as a layperson going into medical practices. When you chart your course through this, one of the pivotal moments for you to now start doing this book a little more chronologically is you're in your residency with you're 3 years in, and you fall pregnant. It's not expected, but then you have a line which I've underlined in here, but I remember your book well enough to be able to talk about it without just looking at it. But you say how when the baby is born, though the baby was unexpected in the beginning, you're saying, well, what is this going to do? I'm going into my busiest time of training. Isn't this going to screw the whole thing up? And then you find your way. And I love it because it's a real chronicle of how a woman, a mother, a physician, but someone going into any profession, finds her way through. So it's a great story. But at the birth, you say something that you don't say anywhere else in the book. You say it was the happiest moment of you and your husband's lives. And you literally lift that out, not when you graduate, not when you get an award, not when you save some patient, not later, nothing. And then later you ask your son, what did you miss during your childhood? Because I was doing all this other stuff. And he tells you very reassuringly, I had a wonderful childhood. Forget it. It was great. And then your mom is very wise because
yes,
she says to you, you know what? You're the only one feeling bad right now. Your son's fine.
yeah.
Um, he's going to need you later. Get this done and move on because he'll do better with you in practice than he will, sitting at home. So I just want to say, as someone who, I have 3 grown kids and 5 grandchildren, and I do childcare for the 3 youngest ones because they live across the street. And I'm very involved with family life. And it so resonated with me because people ask me, oh, what do you do? And of course, they're expecting a professional answer. And
Yeah.
basically what I do is I'm a grandfather now. And before that, I was a father. And then somewhere way down the list, there's, oh, I do earn my living by being a writer. and do
Yes.
some podcasting and stuff. And I love that in your book. I've got to just tell people that um, you don't go on at length in a maudlin way about, oh, wonderful babies and family and all the rest of it. But the passion in that statement that this was the happiest moment of your life in the context of a book that basically is all about smashing glass ceilings and doing wonderful things as a woman. I just found the balance breathtakingly beautiful.
Thank you so much. It still was the most wonderful moment of my life.
Yeah, I just loved it.
Yeah.
And okay, to go to the dark side of that experience, you in the book you write about how you had a lot of problems with that led up in the end to a hysterectomy. That spoke to me too because my wife Jeannie bled for 2 years on and off until she finally went to Mayo Clinic, and they did what somebody should have done long before, which was do a hysterectomy. And really, I mean, she got exactly what you talk about in terms of a brush off. We'll put you on the pill for a while. We'll see how that works. And nobody really looked.
Yes.
I so resonated with that example, and I got it, and I love that you have it in your book on neurology, although it's about you. And so I want you to talk a little bit about that in terms of just that arc of experience, which you describe very well in your book about bleeding on and off, and then it takes a while, and then finally you get some proper things, and then the person says, this should have been done a year ago. What you've been doing here. How does a doctor who knows as much as you know let that happen to you when an average person out there isn't even a doctor, and it's happening to everybody everywhere, and women everywhere are treated the same way so often?
Exactly. I trusted this doctor, and I've always been really, really healthy. So in my own mind too, I was in denial that anything was wrong with me.
Yeah.
So she did a biopsy when I first went in and assured me everything was fine. When I went the second time with the same problem, she did a biopsy and an ultrasound, and the biopsy was fine. And the ultrasound showed a polyp, and she said it's a benign polyp.
Yeah.
The radiologist feels it's benign. I feel it's benign, and my symptoms resolved. So I didn't want to think anything was wrong. So I went on my merry way and didn't think about it again until the symptoms recurred. And this time she said, it's just stress. I'm not going to biopsy you again. And that's what rang in my mind is there's something wrong with that because I'm no more stressed than I've ever been.
Exactly.
That to me felt like a brush off. And so I thanked her and wished her well. And the more I thought about it over the next few weeks, I thought, no, something's wrong.
Yeah.
And when someone says it's just stress and they're dismissing you, you really feel dismissed and not heard.
Yeah.
That was what made me think, I'm going to get another opinion here.
Yeah.
And they said, oh, you should have had that polyp out a year ago.
Yeah.
And it turned out to be malignant.
Yeah.
So fortunately, I got help in time. Had I followed her advice and
it would have killed you because you when they found you, you were stage 1 still.
Yes.
Which was I breathed a sigh of relief when I read that.
Yes.
I didn't want to have a note from the editor at the end saying, and she passed away at Christmas, and it's a posthumous book.
Yes, because that was
She's gone to join her dog.
Missed your dog so much.
But I thought that was great because when I read this book, and this in no way denigrates the rest of the book, but the bits I liked best was your most personal story of med school, having a child, finishing your residency, working at the VA, how you progressed through that, early experiences. I thought it was really a wonderful thing to describe in such detail, how the sort of, what is it, see one, do one, teach one thing where you're just, and the other thing that I found very gripping in that personal early section was the fact that, that you did that whole dissection. Obviously, we know that doctors do that. And so you're in this elderly woman and you're looking at the sort of empty cavity when you've taken the organs out and all. And then the next dissection you do then is like a malformed fetus or something, but that's in a pathology thing. But then you come across this child who I think was a 10 or 11-year-old little girl. And I have a wonderful female doctor, Leila Karos at MGH, Bullfinch Medical Practice. I don't mind plugging them. And she's been my doctor for 25 years. And, every time she examines me, she's exactly the opposite of brushing off. And, she talks to you and she's wonderful and solicitous, and everybody should be so lucky. I just feel so fortunate. Um, but one of the things I can never quite picture Layla doing, because she's so gentle and so forth, is cutting open a cadaver. And I enjoyed your thing because, anytime you spend time with a physician or somebody, they have paid a price to learn what they needed to learn to save your life or to treat you. And I think that's overlooked a lot of the time. And I think your book does it in three great ways. You do the dissection thing and the pathology thing terrifically. Um, I was really there in those passages without overdoing it. I mean, anybody can read this. It won't make you sick. It's just terrific. I really got into your head at that moment. You do the struggle of residency and learning and the brush off from some people who are mean and some people who are unexpectedly kind. Like that guy says, okay, fine, I'll let you take some time off, before there were these things for women who are pregnant. And then you really get into the burden of, as a compassionate person, of getting close enough to your patients so that you are carrying their grief with you. Because as you say, you know, um, neurology is not for wimps. I mean, your people are in real trouble and lots of them die, and you have to tell bad news. So that's a long way of saying, okay, at length, and I won't interrupt you, talk about your growth from a young woman getting into this to the present day in terms of what you learned about breaking bad news to people and absorbing some of their grief into yourself, without it just crippling you, because you're hearing one sad story after another. These people die. Parkinson's patients, everybody else who comes through your office is in deep trouble.
Yeah. It was a lesson I learned early in my career. I think
Mm.
my mother died in my residency. I was only a neurology resident for 3 weeks. And living that grief and that feeling of helplessness and
Yeah.
that feeling of, medicine is fallible, that doctors are human and
Yeah.
mistakes are made. And you don't like to think that they are, but they were in her case.
Yeah.
And when I went back and tried to go right back into residency, now I'd done a year of internship in internal medicine, and then I was only 3 weeks into neurology, which
Sure.
I loved, and I couldn't wait to get into my neurology residency. I was so
Mm.
eager and excited. And then all of a sudden, I just saw these people, and they reminded me of my mother. I would
Yeah.
see ventilator in the ICU, someone unresponsive. I
Mm.
would see I would talk to the family, and I felt their pain in a way that I couldn't have felt it if I hadn't lived it myself.
Yeah.
And so it was so overwhelming that I almost left medicine.
Well, and at one point, somebody finds you sobbing in a little room, comes in and finds you weeping.
Yeah, I went back. I had to go back.
Yeah.
Died on Thursday. We buried her Saturday, and I was on call on Sunday. And
Yeah.
I'd
Yeah.
already been gone for a week, so I had to go. And I thought I'll be fine. I just need to see a couple of patients, and once you get into the groove of things, you can put other things aside, and you
Sure.
can. And one of the first patients I saw yelled at me, saying, "What are you doing here? I don't want a woman. I want a man. You don't know what you're
Yeah.
doing." And so I yelled back at him.
Yeah.
Um, and that's what got me. And then I just ran to the restroom and started to really cry in a way that I hadn't been able to at the funeral. Well, I did cry, but
For
nothing
your
like
mom. For your mom.
this.
We're
My
talking about
mom.
your brother. Yeah.
Yeah. And I was crying so hard that my beeper kept going off. I couldn't
Yeah.
answer it.
Yeah.
There was a neurosurgical resident trying to sign his patients out to me. He'd been on call all night, and
Yeah.
he heard me in the restroom, and he finally found me.
Yeah.
When I told him what was wrong, he said, "Go home. Just go home.
Yeah.
I'll take your call today."
Yeah.
And then I came back the next day. But um, and I was in a fog for a long time. I was there physically and I did my work, but I was desperately thinking, how can I get out of this
Yeah.
world of death and dying?
Yeah.
And so I contacted someone about a new ophthalmology residency that they were trying to get started that year, and they
Mm.
accepted me for it. They said, just tell your chairman to call us. And I thought, that's great. Ophthalmology people aren't dying on you.
Yeah.
You're not giving them bad news. You're just taking their cataracts out. Um, but as the time went on, I realized, I don't want to do that. I never did.
Yeah.
I want this human connection. And I found my way back out of the grief with new eyes, really,
Yeah,
new eyes of compassion that I can be maybe more compassionate with the families
sure.
than I might have been otherwise.
Well, you have several interactions with that because it's not only your story, but your mom's, your brother's, your father, and then your son almost dies or could have with this throwing up and losing weight. And then, you know, and so I'm going to throw something in and then go back to what you're saying, but I think it informs what you're talking about. How would how has the human side of being a person who has grieved themselves and been fearful within a medical context affected how you treat your patients, one, and two, the fact that you only have serious disorders and a lot of bad endings in terms of survivability. Um, it would seem to me that it would go one of two ways. You'd either have to put a huge wall between you and reality, or you would become a very compassionate person. I think you chose the compassion path. But that must also, does that work out okay for you? Or are there times when that was just too much?
There were times when it was too much, and that's when I developed this journaling that I did.
Mm-hmm.
When you don't have time really to go and see a therapist or talk things out, or,
Sure.
I've had a bad outcome. I've got to recover from this before I can deal with that kind of case again. You can't do
Yeah.
that. So I would write about it. I would come home and I would spend hours just pouring out my feelings in a journal.
Mm-hmm.
That's how I processed it so that I could take it from here and put it here. And
Mm-hmm.
that way I could go and face the next case.
Do some of those stories show up? Because I know you changed some of the names and the places because you're dealing with people and you want to be sensitive. But on the other hand, all of these were drawn from life, so I'm sure you had more things than you could possibly fit in one book because that's a lifetime of practice. There had to be a competition between those stories in your own head. Like, what
There
do I
did.
use here?
I tried to take different stories, so that it wouldn't be all one topic.
Sure.
In this book, there's something for everybody. There's Parkinson's, there's ALS, there's
Yeah.
stroke, there's addiction. And I tried to show different types of addiction. There's the addiction from the person that was put on a drug by a doctor and then he couldn't get off. There's addiction because a kid was exposed to drugs early in life when their brain is developing
Yeah.
and they just fell into that path. There's addiction from enabling. And
Well, a
so,
nitrous oxide, this woman who was doing that and destroyed her part of her spinal column, or I forget what the problem was, but it was a huge deal and she wouldn't admit it. I was interested that addiction figured up there with all your other serious problems, and you treated it very well, I thought. Let me just reintroduce you here. This is In Conversation with Frank Schaeffer. My guest today is Carolyn Larkin Taylor, MD, and she is the author of this incredible book, Whispers of the Mind, a neurologist memoir. And I can genuinely say I love this book, and I literally read it from end to end, turned the pages. It's completely dog-eared. I have tons of quotes in here of things that I found just very, very moving on all the subjects we're talking about. And I'm going to read one here that I just want to give a piece of what the book is sort of like. You're talking about George was tall and athletic build, reminded me that he was a competitive tennis player. He was good looking with a boyish grin, brown curls, and bright blue eyes. As he stood in front of the group wearing his signature bow tie, I caught a glimpse of the characteristic reddish brown skin lesion extending from just below his starched white clinic jacket onto his wrist. I said nothing. At that moment, I knew George would never realize his hard earned dreams. He would never make it to his fellowship. In the coming months, he was destined to be shunned by his own academic home. He would be given a job at a competing institution, where as an attending neurologist, he would spend the next 18 months of his life teaching until he died alone in the hospital, with no one by his side except his dear friends, his own family having disowned him in his time of greatest need. The unjust ostracization of the AIDS patients in those early years of the epidemic was, in many ways, so much worse than the virus itself. So he was a colleague who was a neurologist, and you lost him to AIDS, but the way he was treated is a sort of a bookend to the way people should be treated. And it's one of those places where you just feel the total failure of a system to do what they should. And of course, you place it in the historical context of the Reagan years. But anyway, um, that wasn't actually a case of yours, but it was someone you were working with.
right. It was terrible time back then. It was in the early 90s.
Yeah.
Um, AIDS patients were quite ostracized.
Yes,
And
they were.
it was shocking to me to see his own family
Yeah.
not have anything to do with him. I
Yeah.
mean, clearly they had to have known he was gay, but as long as it wasn't out in the open,
Yeah.
they were fine with it. But as soon as it was just an embarrassment to them.
Yeah, a little while ago we did an interview. I did an interview with someone, an author by the name of Melanie Brooks, who wrote a book called A Hard Silence. Kind of, you'll be interested in this, a twist on your story that so much confirms it. And that is her father was a surgeon and got AIDS from a blood transfusion that I think he was having an operation himself at some point and died. And he was also an evangelical Christian in a very conservative community. And so he hid the fact that he had AIDS and made the children hide it because they would have ostracized him because at that point, no, this is the gay disease. And it would have been proof that he was gay.
Yes,
He
yes,
wasn't. And so it would have been a double injustice. But
yes,
her whole book was about the fact that until she was an adult, she never talked about this with anybody in the family because it was the family secret and it was so dark and so hidden. And so, having done her book, A Hard Silence, which the whole book is on being the daughter of someone who hid their disease, it really hit home. And then I had a personal experience back in the mid 80s. Making a feature film in Hollywood. My features were terrible movies, and I'm a writer. I'm a good writer and a mediocre filmmaker, but I did make 4 features in Hollywood. One of them was called Wired to Kill, and Merritt Buttrick, who was one of our actors, was the first person I knew personally who had AIDS. And this was really early, and at that point, it was called the gay cancer.
mhm. Yeah,
Like it was this thing.
yes,
Nobody had a clue, and there was no treatment. You were dead. And I
absolutely.
remember feeling quite honored in a way that Merritt told Jeannie, my wife, and I the truth about it. But he said, you can't tell anybody else, or the other actors and the crew will quit because everybody's so afraid of catching this. In those days, they had no idea how it was transmitted, or if they did, they
Right.
didn't want to know. And so we shot the whole last half of the movie hiding his secret from him, from the crew, and keeping him working. And then, he would be mysteriously absent in the hospital for a couple of days, make enough of a recovery to come back and shoot. So we kind of had a crash course in the disease, not knowing anything about it, but being asked by a friend, look, I'm going to tell you that I've got the gay cancer. Who knew? We didn't even have a name for it then.
Right.
But if you tell anybody, I'll never, I'll be out. There'll be the end of the shoot because everybody's going to quit. And that's on a movie crew in quote liberal Hollywood. So
Yeah.
I had enough of a touch of this that when I got to that story, it really choked me up. I completely understood what you were writing about.
Yeah. And I think people today don't understand it as much because if they didn't
No.
live through that time, and AIDS is so controllable right now.
Yeah.
And being gay is so much more out in the open and
Yeah.
considered, it's just how someone is. It's not anything to be ashamed of.
Yeah,
Just
exactly. And you talk about the fact that in that era, it was this wicked thing and a shameful thing, and you hid it, but also that it was classified as a mental illness and so forth and so on. So you give a context to the story.
yeah.
But I just wanted to pull that out, and I want to do a couple other things, just show people the scope of this book. And the addiction section, you say dealing with addiction is one of the most challenging tasks for a physician. So talk about that a little bit. Get into the addiction part of your book, because it's not the first thing I think of when I think of neurology. I think of Parkinson's. I think of traumatic brain injury. I think of the story in your book about the parents who send their kid back in to play, even though he's had a concussion, and you're there in the stand telling them, don't do this. I happen to be a neurologist, and your son just got knocked out. He's going to have a brain injury. He needs attention. And they say some crazy thing to you like, well, you just want your kid to get more playing time, which was not to the point, and wouldn't listen to you. And that was an incredible story, but that sidetracked for a minute. But let's go back to this addiction path and why you saw people who needed treatment who were addicts. Did they come to you for that, or were there symptoms related to that in terms of neurological disorders?
Uh, both. You often, as a consulting neurologist in the hospital, are the one to declare someone brain dead.
Yes.
when someone comes in with an overdose. And so you
Yeah.
get introduced to the addict that way and their family.
Yeah.
Then some people are addicted to medication and they say it's for pain and they say
Yeah.
they've chronic headaches and they come in on these huge doses of opiates and
Yeah.
so dealing in that situation.
Yeah.
In every case, I had one patient that I talk about in this book that had MS and he was put on medication because of
Sure.
spasticity. And then another patient kept getting put on our service for headaches when it was really an addiction problem.
Yeah.
So they come to us in odd ways. Um, Addiction, the addict that is addicted to alcohol or nitrous oxide, which is
Hmm.
a lot of people don't know about,
Yeah.
can have devastating nutritional deficiencies, which
Yeah.
affect
Vitamin B12 you talk about. How does that relate, by the way? I'm just to the spinal situation. I think you said it in your book, but I can't recall what that was.
B12 is a critical vitamin for the nervous system. So the
Sure.
peripheral nerves and the central nervous system.
Yeah.
So with the B12 deficiency, one of the first things that happens is you get peripheral neuropathy, numbness,
Yeah.
tingling, loss of balance in your feet. But
Yeah.
if it progresses, it's so vital to the brain and spinal cord, you get something called subacute degeneration of the spinal
Right.
cord.
Yeah.
It degenerates. And you also get a dementia.
Yeah, and she got that because she was, I guess, breathing this nitrous oxide in as a for a high. Then you also talk about this young man laid out on the either a gurney or in his bed that you pronounce brain dead. I think that, beautiful young man, curly hair, the whole bit, and he had overdosed on something.
Yeah, a combination of things. They found cocaine and heroin in his system, and he
Yeah,
was living on the street.
yeah,
Um, and the devastating thing for me was I'm there, and all these episodes kind of reminded me of my son. I
yeah,
just about the age of my own son, and
sure.
looking at him, such a beautiful young man. And then when we finally located his parents, they would have nothing to do with him.
Another like the AIDS person who
Yes.
dies, his parents had rejected him, and they said we had nothing to do with him. We tried to put, but you're quite sympathetic to
No, I
them.
understand. No, I could understand when
Yeah, because
so
they
many times
they had tried.
they tried. They went to rehab and they put him through rehab and he'd leave and he'd go back
Yeah.
out on the street and they're just so frustrated with how to deal with it.
Well, of
But I
course, when it came back to the sports head injuries, I just want to make sure people get this. Your son was a great athlete. And so, of course, you're a sports mom going to
yeah.
games. And then you've got young patients who are coming to see you because now they have traumatic brain injury from the same sports your son's playing.
Yes, especially when I lived out here in the community and I had a more of
Yeah.
a community practice. They all knew my son. And
Yeah.
so they would come to me and I'd say, you've had too many injuries this season. You really can't play.
Yeah.
Well, would you tell your son that?
Yeah.
But I could, after a while, I could relate to them. The parents understood. I said I would tell my
Yeah.
son the same thing.
Yeah.
You'll play next year, but
Yeah.
what if you hurt yourself this year and never get to play again?
Well, and you talk about that condition where if you hit your head again within a certain period of time after a concussion, that second whack, if
It
some
can,
stupid coach sends you back in again, can kill you.
yes, and that's peculiar to the young developing brain.
Yeah, you got to rest your brain.
You do. You've got time, and
Yeah,
it's not the end of the world. But
yeah,
I understood having a gifted athletic son,
yeah.
how missing one game to them is the end of the
Oh,
world.
it's huge. Yeah,
It's huge.
yeah, absolutely huge.
And if you
So,
don't have the parents aligned with you, you're sunk because they
yeah.
want to play too.
Well, and if you
I
got
would,
the coach is sending his own son back in again after a head injury. I mean, it's unfathomable. Let me just move on to something here that I want to talk about. You talk in your book. We talked about the dog before, but I'm going to just read a bit about him. Prancer, a gentle creature with a coat the color of autumn leaves and eyes as deep and soulful as the ocean, was more than just a golden retriever. She was a healer, a silent confidant, and a source of unspoken comfort. She was my dog, trained and certified through Pet Partner program to accompany me to comfort patients in my clinic. And that's the chapter is chapter 24, Prancer Tales. And then, of course, there's another thing at the end of the book about the dog. And I was imagining that at some point you would be tempted to write a book about your dog and how your dog treated patients, because I think that would be a good one if I can just put a thought in your mind. I would
yes,
like to read that.
yes. I always thought that always wanted to write and put something into a book form, and I thought my first book would be called Prancer Tales. All
Well,
the different
Prancer Tales would be a good story. I mean, there's no you treated a lot of people. There's a whole nother one just of Prancer interacting with patients. I just
friends. And
but in any case, yeah. So when you get to your relationship with Prancer and your patients and the interrelationship between a very savant, kind animal who was not trained to do this, you had to have her pass exams of not paying attention to other dogs. But this isn't like a guide dog that goes through a whole special rigmarole. This was just intuitive. She related to people
it was all intuitive
and
because
would scratch at the door.
yeah, she was around neurology patients from the time she was a puppy.
Yeah,
So I could take Prancer to a park and she would instinctively want to go up to the person in the wheelchair or
yeah,
somebody struggling. She just had a sense of this person needs help.
yeah,
And the episode with that young man who was quadriplegic was so beautiful because
yeah.
he sat there and said, I would give anything if I love dogs so much, if
Hmm.
I could pet that dog. He didn't call her over. I didn't signal her over.
No.
Before everybody was just in awe, feeling badly for this young man.
But he
For
couldn't pat the dog. He can't
the,
use his arms.
and Prancer just got up and slowly walked over to him
Mm,
without being asked, sat next to him with her muzzle on his hands
that's
the
so sweet.
entire office visit. We were all crying.
I bet.
Yeah. I imagined that maybe this family got this boy, this young man,
Dog.
his own, even though he couldn't reach down and pet him. They give you such comfort.
Well, and that
So intuitive.
Prancer went over to him and I'll pat you. You know, you can't touch
Exactly.
me, I'll touch you.
Yes.
Speaking of angels coming as humans, how about angels in canine form?
Angels in fur. I always say
Angels
that.
in fur. I
Yes.
really believe it. You know, because it's amazing the sensitivity of a dog. And of course, as you well know, like our dog Zip, you know, hates to see a suitcase pulled out, knows exactly what's going on,
Yes.
mourns, walks around the house, who's going to leave, how long will they be gone for? And then the greeting you get when you come back, even if it's a short trip. And we always have somebody in the house to take care of them. We don't put them in a kennel because we just can't do that to them. So my daughter comes or my neighbor's sister or whomever, you know, we plan our trips. The planning to the trip is simple compared to the Zip planning to
Yes.
keep
Yes.
him happy. You know, so it's like, oh no, well, who are we going to get? We can't even think about going somewhere. But the funny thing is when you see the intuition of knowing you're going to leave or something's going on and the dog knows it, the dog's restless and it falls out of the thing, and you haven't said anything or you can't tell you've done anything different, but they absolutely know. And I think Prancer
Oh, she
knew what
did.
you were doing. We're ministering to these people.
Yes, absolutely. She did. She knew who the sickest people were,
Yeah,
and she just sat by their side. If whatever they wanted, she let them pet her.
yeah.
Uh, she would, I don't know, she'd just go up to people. I
Tell
had
the
a,
story of the woman that Prancer went and sat next to, and so you ran more tests and found this incredible thing that you would have missed because she was on her way out, and it was like, but wait a minute, if he's, you know, tell that. It's a
well,
good story.
Prancer didn't take very well to not being allowed to come in the room.
Yeah,
She would gently scratch, and if the patient wanted her in, I'd let her in. If they didn't, I just didn't answer the door. And
yeah.
she'd scratch once, and then she'd lay outside the door.
Hmm.
So as we would go out, sometimes a patient that had said no would look at her and she'd get up and turn around and walk away.
Yeah, like, okay, I'm
You didn't
done.
want me now. You didn't want me before. I'm not going to
Yeah,
come in. So I was very surprised when this young woman said, oh, she's so beautiful. I want to pet her. Can I pet her now? And I thought, uh-oh, Prancer's going to take off. She didn't. She let her pet her.
hmm.
And then instead of coming back to my office with me when the woman went out to the front desk,
Hmm.
patted after her and got under her chair. And when I called her, she wouldn't come.
Yeah,
She just sat by that woman's side,
wouldn't leave her.
would not leave her. And the woman didn't have anything wrong with her neurologically, but I was like the last step before this woman went on to see a psychiatrist because she
Yeah,
had a lot of trauma as a young child. And they said, well, maybe your symptoms are coming from there.
yeah,
And I thought, I really believe Prancer was telling me something.
yeah,
I went out and I said, I changed my mind. I'd like to just redo some of the blood work your rheumatologist did 6 months ago, because
yeah,
sometimes things will show up at a later time.
yeah.
And sure enough, her values were off the scale. She had lupus, And Prancer sensed something was very wrong
Prancer
with her.
knew it.
Yeah.
That's just
I was
great.
able to get her to the right person, and she got a diagnosis, and Prancer was the hero.
Yeah, I love that story. I like them all in the book, but that one, totally bought into it because, like I say, if you haven't had a dog that has some sort of intuitive sense of your life, it's hard to believe these stories. But actually, I have a dog that doesn't discover that I have lupus, not yet anyway. But for instance, always knows when we're ill. So if Jeannie's just taking a nap, when her nap's over, he'll leave or he'll whatever. But if she's had a flu shot and is just recovering for a day or in bed or after her heart attack was in bed for quite a bit of time when she came home after having a stent put in, he didn't leave her side.
Yeah.
And so, he wasn't coming down even looking for food. It was like the whole world stopped. I'm here. I have your back.
Yes.
And the
Yes.
difference in his behavior between when he's in our bed and we're ill and when we're not ill is 100%. It's two different animals.
Mhm.
One is against you, his side against you, and he won't leave. And the other thing that's interesting, and you'll like this how do they know? Of course, the sense of smell. But if I get ill, which thank God is rare, but say I have had a combination of flu shot, COVID shot, and I'm catching up on my whatever it is, and I have a little bit of symptoms the next day, I'm not feeling too good. I have a little bit of chills. If I cough or sneeze, he runs up and sniffs my mouth and nose and then looks because he can smell whatever
Yeah.
he's smelling is not, no, there's something, and the way he looks at me is like Prancer sitting next to that woman.
Yes.
Hey, are you paying it? You're not, this is not right.
Yes. Well, I have
So,
a very touching story about her. When she died,
hmm,
I was working in Alaska at this clinic, and she started to get sick before I left, and she was in chronic renal failure, and we knew it was towards the end of her life, and I thought maybe I shouldn't go, and my husband urged me to go. He said, she's going to be fine. You
yeah,
know, there's nothing serious here any more so than before. Just go
yeah,
ahead. And so one morning, I was the day before I was coming back. I awoke at about 4 in the morning in Alaska, just woke up, and I felt like she was with me. And I just said, this crazy, this crazy. She can't be here with me. If she is, she must have just died. She just can't be here. And I got up and I thought, well, maybe I'll take some Tylenol. I have a little bit of a headache and I couldn't get back to sleep. And so I'm leaving for work to go to the clinic around 7, and I get a call from my husband, and he said, I didn't want to wake you up in the middle of the night, but Prancer passed at
yeah, yeah,
exactly 4 a.m., the
yeah,
exact moment I woke up and
yeah,
felt her. And I really think she, in that moment, came to me. I
yeah,
couldn't see her,
yeah,
I couldn't feel her, but I felt her spirit,
yeah,
and I knew, and that
yeah.
was
Well, you had a not unrelated experience with your mom
yes.
where you had a sort of a vision of something very specific. Tell about that. Yeah. And by the way, if you read this book, everybody, um, you know, Dr. Taylor's not a crazy woman. She's telling things that in the book make total sense, and you're saner than the sane. Your own brain is in good shape. Having just read your book, I can verify that. But I love these stories because you're a real woman of science. You've got the real chops. You've had a terrific career, and yet you had this vision of your mom in the hospital, and then it panned out, and now this thing with the dog, and you've had similar things with other people and patients and so forth. I think that sort of intuitive sense, maybe it's inexplicable, but it's not unreal.
It's not. It's not. With my mother, and this is the only time this has ever happened to me. My mother had this happen to her on 2 occasions with her son before he was run over. He was okay, but she saw it.
Yeah,
And her mother, she saw her fall on the train tracks, but she got off in time before the train came. But
yeah,
it's like in your mind's eye, you have an apparition. It just comes like that.
sure.
And I was crossing the street from the garage, and in my mind's eye, I saw her as clear as day,
Mm,
in an intensive care unit on a ventilator, and her head was tilted back, which is what we do when someone's in shock. Now, I had just seen my mother a few weeks ago. She was absolutely fine.
yeah,
and it was gone just like that. It was like an apparition. I saw it and I thought, what was that?
Yeah.
I thought, I'm just my mind working overtime because I've been working so hard and I'm dealing with people in intensive care units. And I don't know why my mother showed up there, but it was nothing. And that night I get home and I told my husband about this. And he said, you give me you really spook me with these things. He said, call your mother. I said, no, she's fine. He said, no, I think you should call her. I said, no, no, she's fine. I'm not going to call her. She's fine. I know she's fine. And then my sister calls and says, Mom's in the hospital. She has this irregular heart rhythm and a respiratory infection, and they're going to have to put her on a respirator. But doctors expect she'll be okay, so don't worry. And so it was almost like, oh my God, I saw this, but in that apparition, I knew somehow she was dying. And I went and saw her in the hospital the next evening, and um, I was a little uneasy about some things, talked to her doctor, and then I went back home, went to work the next day, and I got the call that she had bled out into her abdomen
Yeah.
and was unconscious, and they were trying everything they could to resuscitate her. And I knew at that moment
Mm,
that
mm.
what I had seen was what was happening, and I knew
Was
that
that what's going
I was
on
going to die.
then?
Yeah.
Yeah. Yeah, and it's very convincing. I mean, it's not woo-woo stuff at all, nor with you, feeling visited by the dog. So
And
let me
that's never happened to me again. It was just
No, I
like,
mean, this is not something that you're saying is happening every day here.
oh,
No,
no, no.
I totally bought it. So let me get into something here that's off. Believe me, there are so many underlying passages here that I was going to read you and all this stuff. But the thing is, I know the book well enough, so we are ranging through the subject, and people are going to read it themselves in my book club. I just want to pitch this book and do a little commercial for it and say this, that if you are like the millions of Americans and people all over the world who like watching medical dramas and who get into the good ones, like The Pit or whatever, on TV, some of these series, they are nothing compared to this. This is the real deal. But you could be writing those scripts. So unless you've given up on reading it completely and all you do is text on the phone and play video games, if you're ever going to get into any book about medical practice, with Carolyn guiding you through it, gently holding your hand with the kindness of her and her dog, you will love this book, and you will learn a lot because it's full of medical facts that actually everybody's going to find useful because we all know someone with Parkinson's. We all have symptoms we wonder about. We all compare doctor experiences with other ones, and we want to find good practice. You read this book, you'll know how to get it, but also you'll understand a lot more about neurology, and it's absolutely fascinating. So that little commercial aside, how do you think, what do you think the human brain is in terms of personhood, spirit? Is there more to humans than just the brain? This is not a loaded question, but you talk a little bit about angels in your book. You have this apparition of your mom, and then you know exactly what's happening because you've sort of seen it. I'm not trying to pin down, your belief. I come out of an evangelical background. I left. I describe myself these days as an atheist who prays. So go figure. In other words, I believe in paradox and uncertainty. But I see a real I'll tell you how I think of it, and then you tell me what you think. I think we are biological machines, but we look at the world through spiritual eyes, and it's a paradox because that's who humans are. And so I don't have any philosophy about the brain, but you're a neurologist. You've seen everything. You've been with many people who died. You've given many people bad news. Um, you're a kind person. And I want to know, as you wind down your career, how you look at the human brain, the human mind, the spirit. Um, who are we really in there? Because that's a real question. I have no theory on it, but I really want your take on it. I haven't had a chance to ask anybody who actually knows what they're talking about, and I want you to tell me what you think.
Well, I have a theory. I was brought up Catholic, but I'm not really a practicing Catholic. I don't believe in any particular religion.
Yeah.
Not an atheist. I don't know if there's a God, but I think there is more to more than this life, whether it's a consciousness outside of this life.
Yeah.
But I think there are good vibrations and bad vibrations, and I believe that we have a consciousness, and
Mm.
the consciousness, some people might call it our soul or our spirit, but
Yeah.
I believe there's a consciousness, and that consciousness works through our brain,
Mm.
just is like the hard drive of a computer, but the
Yeah.
consciousness directs it what to do and how. And our, I don't think the brain is, we need our brain to think, but I think that there's some soul outside of that. I
Mm.
really believe that.
Mm.
And you hear all these stories. I've never had a near death experience, but I've known a couple of people that did, that were pretty convincing, where they feel like they rise out of their body and they're looking down. That just gives me some hope that there is more than just, we close our eyes and that's it, like
Mm.
a dead flower. I think there are souls, but whether there's a God, I don't think there's somebody up there with a white beard floating around in robes. I don't know what there is, but I believe there's something after this life.
Yeah, and you have an interesting, I mean, it's also sort of counterintuitive because it's a guy who's, if I can recall the story correctly, sort of collecting a lot of Valium because he's got an incurable situation. You talk about assisted suicide, but he had had a kind of a near-death experience. And while he was dead, before he was resuscitated, he felt totally peaceful and saw blinding light. And then they bring him back and he's disappointed. And so when he does decide to finish his life, and you can describe the circumstances if you want, he feels very peaceful about it because he says, I'm not scared of death.
Yeah.
Been there, done that, and it was okay.
He was a real regular guy in EMT, and he was not someone that was religious or thought much about those things, but his
Yeah,
life was such a living hell
yeah,
that when he had this experience, he didn't call it a near-death experience. He just said, I don't know what it was, but I do know I was clinically dead for a few moments, and it was the most wonderful feeling.
yeah,
And now I'm not afraid.
yeah,
His life was had become such a misery because he was so physically ill,
yeah,
vertigo and nausea all the time, that he chose to do this. And
yeah,
I understood. I'm glad he didn't tell me about it beforehand.
yeah. You didn't want to be party to it, but you totally got it.
I totally, totally got it when
Yeah,
I heard what he had done.
yeah. In terms of your own, we've bordered on this kind of spirituality now. I find with myself, that one of the reasons I pray is I so enjoy my children, my wife, the fact that we've had this privileged relationship. I've been with her for 55 years now. She married a teenage asshole, basically, and forgave me and stuck with me enough and pushed me toward therapy enough and really stuck with me that she literally changed my life. I mean, not in some hyper, I mean, actually, I'm a different person in measurable ways that, anybody could quantify. Um, so I was saved by somebody. I mean, literally saved. And one of the reasons I pray a lot is because I want to say thank you. So I don't know what's out there, but for me, it's the gratitude of the beauty of life and the shortness of it, which your book really touches me with. Here it is again. Because one of the things I love about your book is it's written in that spirit. You're grateful for each patient. When my son came back from 2 combat tours in Afghanistan as a Marine and got married young and is wonderful and has these 3 kids and they live across the street, I said to him, well, your friends are saying you're getting married too young, blah, blah, blah. And he said, hey, one thing I learned in Afghanistan, life is short.
Mhm.
He
Very,
wasn't going to mess around. He was done being a child or even a young adult.
yeah,
That it was over with.
yeah.
Like, let's get this thing going because
You don't know.
wake up in the morning,
Nobody
everything's
knows
fine. And by
exactly.
tonight,
Nobody
you know,
knows how much time they have. You have
yeah.
to
So
live.
talk a little bit about that insight because that just is, you don't come out. I mean, there are some lines that are close to what I just said there, but let me just see if this is one of them here. Well, you say the challenge is often with the diagnosis with proper treatment, most patients go on and live normal lives. This indeed was a happy ending. You talk about that, but most of those don't end that way. And you're helping people face death, which means that you have faced your death and mortality 1,000 times. There's no way around it. Just like when you get a head injury of a young ball player, you're thinking of your 12-year-old.
Mhm. Yes.
So talk about that because, just like I mean, you've seen death up close and personal in a way that I never will, and no one listening to this will unless they are you and have lived because you're not just a neurologist, you're a neurologist who's had this whole career.
Yes.
So how do you, when you think about death, I'm not talking about, oh, what happens to us? We've sort of talked about that. But how do you look at it? What is a good death? What is a bad death? Even more to the point, what do we do for ourselves and those we love? I'm 73. I'm not going to be here forever. My grandchildren are very much love Jeannie and me and so forth and so on. How does one prepare them to deal with the fact of your mortality, the fact that I might get Alzheimer's, that, I'm not worried about who would care for me. I'd be surrounded by loving people. But there's a poignancy to getting older that you're not, I don't know how old you are, I'm not going to ask you, but there's a poignancy to that that makes me face now what you've faced for the last 50 years as a doctor, but as a neurologist.
It's hard because we have to, when you deal with people that are dying, it forces you to face your own mortality. So
Yeah.
I've been thinking about it for a very, very long time. And I've always been aware. This is one of the things my husband really loves because I'm always saying to him, just be thankful you're healthy, be thankful you're still alive because
Yeah.
look at this person, look at that person.
Yeah.
And it's the kind of thing that most people don't think about. So I do believe, I really do believe there's something after life. I don't
Mm.
know what it is. I don't think
Yeah.
anyone does, but I believe there's something after life. And I believe that no matter how much we face it or talk about it, we're all going to be scared at that moment.
Yeah.
And I think a good death is someone that doesn't have regrets, someone that,
Yeah.
and I don't think it matters what you do
Yeah.
for a living. It's it's what you make of it.
Yeah.
Um, people talk about, isn't it wonderful you knew what you wanted to do all your life and you got to
Mm.
do it. So many people
Mm.
don't know what they
Mm.
want to do. But it doesn't matter what you do. It's that how you do it, that you make the
Yeah.
best of it, and that you somehow find a way to help others get through life. Helping other people is very, very important in giving back. And I think they're the people that have the good death. We're all going to suffer somehow.
Yeah.
I hope, I wouldn't want to be someone with Alzheimer's that's sitting in a nursing home,
Yeah.
but we don't have any control over that. We
You
just,
have you have a sub thread, another little thread that runs through your book is a couple of stories where you use the word karma, where someone who had an abortion a long time ago feels that because of the karmic kind of retribution, and you have a very good thing, by the way, about abortion and choice and all the rest, and very compassionate. And so you're not trying to make a point about abortion, but that's the story. And then you have another person who has had an affair earlier, and they both interpret this as somehow their neurological illness, what happens to them later, is interpreted as a karmic punishment of some sort for that. So when you talk about regret in your book, you have several stories where the regret is already palpable. And I'm wondering, in any of those cases, were you able to talk to these people and say, that's not how I see it? Or were they kind of stuck on, hey, I'm being punished? This do people look for reasons why bad things happen to them and then dwell, look, I did this, I did that, or is that, is that normal? Is that something that happens with a lot of people that you've seen, or did you include those stories as anomalies?
no, people feel guilt, tremendous guilt. This one gentleman had tremendous guilt over the fact that he had had an affair with his wife's best friend and
Yeah.
that broke up his family. And so when he got sick years later, he thought that, the world was punishing him for that because he still
Sure.
carried that guilt. And the same thing with the man he and his wife had tremendous guilt over having an abortion.
Yeah, they had four kids and she got pregnant with the fifth, and they weren't able to manage it at that point. And then they have a sixth child, if you count the aborted child, and that child
To try to make up for
to
it.
make up, and then that child is the one that gets ill, I think.
No, the mother
The
suffered.
mother gets ill. Yeah, he
So
loses the mom.
five.
So now he's stuck with four kids as a widower.
Yes, five.
Yeah, five kids. Yeah.
And he got, son, both patients came to me and asked
Mm.
me if I thought that was karma for what they did. And of course I said no.
Yeah.
No, I don't. I think that bad things happen to everybody.
Yeah.
And you were sorry for what happened. Everything that you did was, well, the abortion was understandable.
Yeah.
And people have affairs for all kinds of reasons.
Of
There are
course.
things not going right in their own their
But even
own.
so, there's a million people that have affairs and nobody gets killed.
Exactly. Nobody develops a devastating illness.
Right.
I don't think that's karma at all. But people feel guilty and they confide in their physicians.
Sure, of course you do. And so did you find yourself did your Catholic background help you play priest at some points, or didn't you have that sort of, my wife grew up as a Catholic and she had a favorite nun that she refers to as Sweet Sister Patrice, who was her teacher in first grade, and she's never forgotten her. And Jeannie's 74, and she sort of compares anybody to Sweet Sister Patrice. They're nice, but are they as nice as Sweet Sister Patrice? Who had a class of 50, by the way, and had never been trained as a teacher. I mean, crazy Catholic stuff. But
Yeah.
do you find you have your diagnostic skill, your hand holding, and then now we know what's going to happen to someone in the later visits when they come for checkups? Are you a priest or a doctor?
A doctor, I'd say.
But you're talking to them about
I
final
don't,
things
I,
and
right,
guilt.
right. I talk to them. I don't, I listen to them.
Yeah,
So mostly people in that situation need to be listened to.
yeah,
They need to talk about death because their family won't talk about death with them.
yeah,
Look forward to their visits with their doctor that's caring for that problem because they want to talk about death.
sure.
And you just have to give them that space and that time. I don't, I try to avoid being judgmental or preaching to anybody. I'm
Yeah.
just in there to listen and validate their feelings,
Yeah,
really.
you talk about this one young woman who is a beautiful young woman who her whole concern was, how do I tell my mother I'm going to die? And you put that in the same context of a chapter where you said, well, I believe there are angels, and I think sometimes they come to us in human form. And then, and I'm asking you just as a writer to writer here, it was sort of shocking, but in a great way, like you're going to keep turning these pages, that this angelic person, who is more concerned for her mother than for herself, in the context of you saying you believe in angels, it's not a happy ending, but her concern is for the person she's leaving. And you read that as a very kind of wonderful thing. And just talk about her for a little minute. And in her case, I was sorry I didn't know her real name. Maybe I do. Maybe you didn't change her name. But I mean, I'm not telling you to say it, but I was someone who you want to think about, like, remember.
Yes. She was so selfless. She was so young. She was in her 20s. I think she
Yeah,
was 8 and was just so selfless. All she
yeah,
wanted was to meet a man and get married and have a family. And she
yeah,
was had her first apartment ever because she had this good job and she gets brain cancer.
yeah,
And it was almost as if once she got over the shock, she was she didn't seem to go through those phases of anger and pleading and bargaining.
right.
And she just went right to acceptance.
Yeah,
This happens, I'm going to be brave. And what I'm really worried about is it's going to devastate my mother because
yeah,
she was all her mother had. Apparently her father left when she was
yeah.
young. She was an only child. And she said, I don't know what this is going to do to my mother. I have to prepare my mother.
Mhm.
That was her only thought, not that she's dying, not that she's what she's going to go through. And she was just an incredible spirit. If there are angels on this earth, she was one of them.
Yeah,
She was just incredible maturity for a 28-year-old.
yeah.
Even when I
Yeah,
tried to
very,
give her
yeah, very moving,
very
and
moved.
instructive. When you met somebody like that, then you're kind of, well, you're the older person, you're the physician, she's coming to you, but then all of a sudden you're being instructed because she's a moral lesson.
Yes, I learned from all these people.
Yeah,
They
I
were
love that.
they were all incredible. My Huntington's chorea patient that would hug me every visit, and
Yeah,
he
I
was
love that.
more and more each time I saw him. He was walking, and then he was in a wheelchair, and his incredible father, who had to go through this with his wife.
Hmm.
She had this disease when he married her, and by then they'd had 3 children.
Yeah,
It's 50-50 whether they'll get it, and all three of them got it.
yeah,
And his incredible spirit that just, his whole life was dedicated to easing their burden and easing their death somehow.
yeah. Yeah,
And
let me ask Ernie if he's put what month. I'm going to span down here. What month are, oh yeah, it has to be read in November. this is going to be our selection, everybody. So Whispers of the Mind will be our book club. It has to be read selection for November. And we're going to have you in our loop and back again. And Ernie will talk to you after I leave here. So don't go away when I do. I'll sign off first. I'm not signing off now, but I will sign off first. And then you stick around for two reasons. First, we want to make sure that we connect with your book and with links and everything else to do everything that we can to promote it. Stay in touch with you for the book club thing. But also, we always ask our guests if they have somebody that comes to mind because of this conversation that we ought to be talking to. And it doesn't have to be somebody in their field. It doesn't have to be a writer or anybody famous. But if when you're talking to Ernie, you're saying, if Frank's interested in this and this and this, I know, somebody with Parkinson's he ought to talk to or a neurosurgeon who I worked with, or maybe it's just somebody else, or maybe it's your publicist or an agent or an editor, anybody interesting that you feel would share some wisdom with us from a perspective that we'd be interested in, given the questions I've been asking you. We're always looking for people to talk to.
Okay. I'll start to think about that.
Yeah. So now I'm going to just get personal at the end here. How are you now? Are you well? You look great.
Thank you. I am. I'm very well.
Your health you seem to be glowing.
Yes, I'm glowing. My 5-year cancer thing is done, and I'm not even followed for that anymore. And
that's great.
My health is perfect.
So, and how are you cruising toward retirement? When you say you're semi-retired, what's your day look like every day? I mean, you're doing your book now, but other than that.
I'm spending a lot of time with the book. I work with as I mentioned, with veterans.
Sure.
Evaluating them for traumatic brain injury. So that takes up maybe 2 days of my time.
Yeah.
And the rest of the time, I'm just enjoying my life.
Yeah.
I have 2 dogs.
Yeah.
A Bernese mountain dog and another golden retriever, and I'm enjoying them.
Yeah, that's great. Is your experience with the vets now any better than your residency? Is the vet medical system any better, or we still have one? Do we still have one? Whatever the cardio machine is that that you go looking for because you can't do one EKG machine, but you didn't plug it in, so it wasn't their fault.
It wasn't their fault. It was my fault.
Yeah.
I'm not in a hospital setting right now. It's all out, so I can't tell you about the hospital, but I can tell you that every physician I have shared that story with, that trained through a VA, and most of us do at least a month or two.
Sure.
Training could totally relate, whether they're in New York or Philadelphia or wherever it is.
Yeah.
Very, very underfunded.
Yeah. Always has been too.
Always has been.
Doesn't matter who the administration is. And having had a son as a Marine who fought in Afghanistan back in 2004, 2005, I track this very closely and care about it. But fortunately, he didn't get hurt. But it's kind of an ongoing scandal in terms of how veterans are treated.
Ongoing scandal, and I don't see it getting much better.
No.
But the veterans, I love the veterans. They're so wonderful.
Yeah.
To work with. And it's just a joy for me to still be able to do this.
Yeah, and I'm so glad that you're doing that now. Are they your employer, or are you working for somebody else and they sort of send you over there? How's that actually work?
It's privately contracted out, so I don't work for the VA.
And what kind of traumatic head stuff are you looking at? Is this from Afghanistan, Iraq, or back to Vietnam, or is it just somebody falls when they get out of a taxi and hits their head? I mean, who are you looking at?
I'm looking at people, a lot of them are Afghanistan, Iraq, who had some head injury while they were there.
Yeah. And they're still suffering?
Well, I'm trying to help figure that out. Is their problem because of the head injury that they had, or the multiple head injuries they had, or is it from PTSD or something? So they see a variety of doctors. They will only allow a neurosurgeon or neurologist to evaluate people with any history of traumatic brain injury.
Yeah.
And so we give our input on that. And then sometimes they have to deal with mental health because they have PTSD, and there's a lot of overlap between the symptoms. Yeah,
one story, and then we'll leave here because you've got other things to do and 2 dogs that are waiting to see you. But I found it very moving again in this aspect of how the vets are treated, that why is the hospital so full on a holiday coming up to Christmas or whatever? Well, because people want to dump their incapacitated vet there so the rest of the family can get away and not care for them that weekend or whatever it would be. And you mentioned that.
It's like respite. I remember I was on call as an intern.
Yeah.
over July 4th weekend, and I got like 8 admissions. And I said, "Is this the way it always is?"
Yeah.
And they said, "Oh no, it's unusual. You might get 2 or 3 admissions. That would be a heavy night." But
Yeah.
July 4th weekend, I said, "Well, so what?"
Yeah.
Well, the families that take care of the veterans just need some respite. So they will
Yeah.
often drop them off at the ER because they have chronic medical issues.
Sure.
And then they'll say, "Well, we're going to pick them up in a few days if they're okay to be picked up." And they said this happens all the time.
Yeah.
We said, "Don't worry, your 8 patients, none of them are going to be seriously ill. They're
Yeah.
chronically ill, and it'll be manageable." They were trying to assure me I'd be able to get
Yeah,
through
that
the.
you could handle it as long as the EKG machine is working. Okay, before we wrap up, is there something that I've missed here, or you misspoke, or you think I did and you want to correct it, or anything you want to, last word here? Because I don't want to wrap up if there's been something in your head saying, "Oh, I wish you would ask me about this," or whatever.
No, I think you pretty much covered everything. Uh,
Good.
but I am pretty level-headed. I'm not um, out there in the spiritual
No,
world,
you're not at all. And believe
major
me, but
medium, but I had these, that was an unusual experience. And
no,
I,
no, no. And I love the fact that you're a science person and you're doing that. And I'm not there either. So again, this will be our November book club selection. And I want to thank you. And also just say the only frustration is that I had prepared a much more sort of about this passage. I have little notes up here, explain this, blah, 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 blah. But the fact of the matter is, since I know your book well, because I really read it, a lot of times I just mark passages to sort of get me through the thing.
yeah.
But I sat out there with my dog, by the way, who was sitting next to me the whole time and read your whole book. And I'd read every page and every word. So I did not get to show off my homework. But I think that's
Oh, I
because
think you did. I think you really touched on just about everything.
okay. Well, I love your book, and I'm very fond of you too. I just want to say you've made a real friend, and I felt that when I read the book. I thought I like her. If she ever calls me and says, "Do me a favor," I'll do it.
Thank you so much.
I
I
mean it. I
enjoyed
feel
this.
so close to you. I just feel such empathy in that book. If I can ever do anything for you, or Ernie can, or anything ever comes up, you let us know.
Thank you. I really feel that. Thank you so much.
Yeah, me too. Okay. Well, much love to you. Talk to Ernie.
Okay, I will do
Okay.
that.
Bye. Thank you so much.
Thank you. Bye-bye.